Kevin Brumet was active growing up, all the way into his 20s. But when what he thought was a pulled muscle turned to severe back and stomach pain, he became concerned.
And things started getting worse and worse, and pain started getting pretty intense. I had no idea what was going on. I thought maybe it was my appendix.
Tests showed that Kevin actually had blood clots in his lungs. But that wasn't the worst of it. Further scans showed disease, including a 2.5-inch tumor in his left lung. Kevin, at just age 29, had advanced stage lung cancer.
It's a numbing experience. When I was diagnosed, I was thinking to myself, all right, I never smoked. I smoked maybe 6 cigars in my life. And, you know, I'm athletic, always try to retain a healthy lifestyle. And I'm diagnosed with this. There's got to be a reason for it.
It was, overwhelming is a good word to describe how it all felt in the beginning. It was very hard to accept.
Kevin and the team of doctors at Beth Israel Deaconess Medical Center in Boston decided to attack the disease aggressively.
We knew already by the extent of his disease that he was not a candidate for surgery. It was impossible to remove all the cancer. And he was also not a candidate for radiation because of the extent of his cancer. We needed a type of therapy that could go throughout his whole body and try to control the cancer.
That meant high doses of chemotherapy. But when that failed to shrink the tumor, Kevin was sent to cancer clinical trial specialist Dr. Bruce DeZubi.
What we did in the case of Kevin is he was young, and we thought his cancer may behave different than other lung cancers, so we wanted to do a genetic analysis on it.
Thoracic surgeons biopsied Kevin's tumor. This is an actual piece of it. Then pathologists sliced it to make slides for analysis. What they found was Kevin's cancer was indeed not the most common form, but the result of a mutation of a gene called EML4-ALK, the cause of about 15 to 20% of lung cancers among non-smokers. What Kevin needed was a specialized treatment to stop that specific tumor in its tracks.
It's a new era. It's an era of where personalized medicine, instead of one drug fits all, it's we take tumors, we analyze the genes, and we try to construct a personalized drug that's going to attack the genes that turn on that tumor.
Sure enough, a drug to inhibit that tumor growth was just beginning clinical trials at Beth Israel Deaconess.
Dr. DeZubi put it very plainly and bluntly, where he sat back and he goes, look, I've been helping patients for 31 years. He's like, anxiety has never cured anyone. He's like, but if it could work. If it doesn't work, you go back on the stuff that you were taking before. But if it does work, you help yourself and you help potentially millions of other people.
Kevin began taking 2 pills a day.
I felt a difference, no joke, within a week.
So this is his entire lung opening up here.
Exactly.
In fact, within just 2 months, Kevin's tumor had not only stopped growing, it was shrinking.
His response to this drug was nothing short of a miracle. We were able to isolate the gene that turned his cancer on and get a drug that turned it off. And seeing is believing.
To see that, it's just, I don't know. It's overwhelming because there's a lot of things that we're planning for the future.
With the results so good, Kevin proposed to Stephanie. They're planning to be married next year.
Hope is so important when you're dealing with something like this, because before he was on that trial, it kind of felt like, well, we're not really sure what's next. If this treatment fails, and then all of a sudden this drug comes out of the blue, and it completely changed his life.
And personalized medicine could change many lives in the future. This targeted approach is already being used to treat some leukemias and certain types of colon and breast cancers.
I'm very hopeful that within the next couple of years, and definitely within my career, that we'll move to a point where we will have real personalized medicine, where every patient is going to get the therapy that is going to be the least toxic and the most efficacious for their specific tumor.
As for Kevin and Steph, they're looking forward to starting their life together, and they are grateful to the team at Beth Israel Deaconess.
Beth Israel has always maintained a certain level of professionalism. I think that I've made friends with people here. I want to try to solve this together, I want to, obviously I want to defeat lung cancer, but I want to do it because, you know, I think we can, you know, and I think that I didn't want to be with other doctors, you know, I wanted to be here. And I think that I made the, the best decision of my life.